Welcome to our mnemonic video on large bowel obstruction. Let's get started. Our story takes place right after an unfortunate parade collision, the cleanup of which will teach us all about large bowel obstruction. In the center of the scene, we see the main float of the day, which is a large statue of, you guessed it, the large bowel. As the procession was rolling along Main Street, a part of a building suddenly collapsed, sending piles of bricks and debris flying into the street. The rubble obstructing the large bowel float from proceeding down the parade route should make you think of a large bowel obstruction, which is the focus of our story today. While everyone is figuring out how to clear up this mess, let's meet one of the event organizers. In front of the obstructed float of the large bowel, one of the parade workers is rushed over to calculate the damages done to the parade float. He's using an old school counting frame, or an abacus, with red and white beads to tally up the cost and crossing his fingers that the city's insurance will cover most of it. That counting frame with red and white counting beads should make you think of red and white blood cell counts, like those included in a CBC. In his haste to get to the float, he's dropped a bag of salt he was carrying and spilled it all over the ground. This damaged bag of salt represents sodium and other electrolytes in the body. These ideas should remind you that obtaining a CBC and checking out the serum electrolytes is part of the initial workup of a large bowel obstruction. Among the fallen rubber is litter strewn into the road from the impact of the building's collapse. Someone's sour, smelly yogurt cup has rolled to a stop near the parade worker's feet. Sour milk products contain lactic acid, which should make you think of lactic acidosis. When there is reduced blood flow to the bowel, the lack of oxygen means that the bowel can no longer rely on aerobic metabolism. This bowel ischemia triggers an increase in anaerobic metabolism, which results in lactic acid formation. This means that as the bowel slowly necroses, high lactate serves as a marker. Therefore, a finding of lactic acidosis on labs can indicate necrosis or infection of the large bowel. Now let's take a closer look at the large bowel float itself. Before it was stopped in its tracks, a motor shaped just like a CT machine was used to propel it. Propped up next to the motor is a poster of an abdominal x-ray. This should remind you that CT scans and x-rays of the abdomen are used to diagnose large bowel obstruction. An abdominal CT scan detects the transition point or point of obstruction. On abdominal x-ray, findings supporting large bowel obstruction include dilation of the bowel proximal to the obstruction, while bowel distal to the obstruction appears thin or collapsed. Having imaging that shows where the bowel is obstructed assists with surgical intervention. It looks like the cleanup crew is finally starting to arrive. This maintenance crew member is cleaning off the debris on the statue with a water hose, starting at the rectum. This is our symbol for a contrast enema, a procedure using water-soluble contrast fluid inserted through the rectum that helps to visualize the colon. If there is a perforation, imaging will show contrast extravasating outside of the bowel wall and into the peritoneum. Perforation of the bowel could lead to peritonitis, caused by bacteria from the large bowel leaking into the peritoneal cavity. So, if perforation is suspected, a contrast enema is a very important diagnostic step. While this maintenance worker cleans off the statue of the large bowel, let's meet one of the parade attendees. She's excited to be in the midst of all the action and is taking a selfie with the halted large bowel float. Take a look at the selfie stick she's using. It's a long, thin, flexible wire shaped like the hostra of the colon that she can manipulate to take her photos at the right angle. It holds her phone at the top, which has a camera and flashlight to help take the best possible picture. This colon-shaped selfie stick should remind you of a colonoscopy, a procedure that uses a long, thin, and flexible scope with a light and camera attached at the tip to visualize the colon and look for any lesions. So keep this in mind. In a hemodynamically stable patient, just like this girl here, colonoscopy is another tool used to diagnose large bowel obstructions. Now let's learn about the treatment of large bowel obstruction. On the right side of the scene, we see an ambulance arriving at the scene quickly to evaluate for any damage done by the obstructive fallen bricks. This ambulance rushing to the scene should remind you that hospitalization is a key step in treating a large bowel obstruction. Complications of large bowel obstruction include bowel ischemia, perforation, and peritonitis, which are all best managed in an inpatient setting. Soon after the ambulance, the firefighters arrive on the scene. There's no fire to be put out. However, this firefighter decided to put his hose to use anyway. It has taken no time for vandals to mark up the pieces of the fallen building, as evidenced by the graffiti on these bricks. The graffiti looks like an image of the stomach and the intestines, so we can say it's a gastric graffiti. Well, gastric graffiti sounds like gastrographin, which is a water-soluble, radio-opaque contrast material that can be taken orally or as an enema. Note that the firefighter's hose starts towards the bottom of the image, that bottom right corner, which should make you think of a gastrographin enema. Gastrographin is less toxic to internal organs. In addition to helping visualize the obstruction, it can help mechanically dislodge an obstruction in the large bowel. So you can think of a gastrographin enema as being diagnostic and therapeutic. Here comes some more city maintenance workers to help clear up the rest of the rubble. This worker is using a colon-shaped crowbar to lift the big block and using a tube to suction out the debris under and around it. We've already learned that this colon-shaped stick is our symbol for colonoscopy, and this tube-shaped suctioning tool should remind you of the function of a rectal tube. Just imagine the colonoscopy poking and visualizing the obstruction, and the rectal tube as suctioning. Between the two of these instruments, one may be able to manually relieve a large bowel obstruction. Up to this point, we've discussed non-invasive methods for relieving large bowel obstruction. If these methods don't work, more invasive procedures may be necessary. Let's meet the next worker arriving on the scene, who is using a scalpel-shaped chisel to break apart the large block of brick. This scalpel-shaped tool should make you think of surgery, which is required to treat large bowel obstruction when non-invasive treatment fails. All of these power tools and activity around the parade floats have accidentally caused one of the other colon statues to be damaged. You'd think one colon-shaped float would be enough bowel for this city, but you'd be wrong. And take a look at the second colon float, which has been affected by the collision as well. A worker is removing the dark, soot-covered portion of the statue from the remaining pink parts. The dark color of the colon represents a damaged necrotic bowel that has had its blood supply cut off. The worker removing it represents the importance of removing an ischemic segment of the bowel. Leaving necrotic bowel tissue in the abdomen is a surefire way to invite infection and inflammation into the body. Removing the dead bowel away from the healthy bowel is a procedure called a partial colectomy. Further in the back, we can see a traffic officer rerouting the parade down an alternate road. And this is here to remind you that after removal of the necrotic part of the bowel, diverting bowel to the skin can be done, and this is known as a diverting colostomy. Even with all of these helpers on the scene, it seems like the cleanup effort is still going too slowly. So here come reinforcements now. On the right side of the scene, we see the heavy machinery has finally pulled up next to the firefighters and ambulance. This excavator is getting right to the root of the obstruction by targeting the heaviest brick in the way of all the parade floats. Note that the excavator bucket contains a crab clinging to the inside. A crab, the symbol for the astrological sign Cancer, is our symbol for a tumor. Tumors can cause a mechanical obstruction that can ultimately lead to large bowel obstruction. Therefore, treatment of the underlying cause like tumors is an essential part of the management of a large bowel obstruction case. So again, treatment of large bowel obstruction usually starts with conservative, non-invasive management. If those measures fail, then surgery and even removal of parts of the colon may be necessary. And with that, you know all you need to know about the diagnosis and treatment of large bowel obstruction.